PerfectServe has facilitated healthcare delivery for over 20 years by improving communication workflows for clinicians so they can focus on what they do best, caring for patients. In the United States, you can find 1 in every 5 doctors and more than 240,000 nurses using PerfectServe at over 400 hospitals and 29,000 ambulatory sites.
The biggest impact that we've seen, and I think the real differentiator for PerfectServe, is the way they utilize what they call dynamic routing or dynamic intelligent routing. I call it the algorithm of how to reach the right person at the right time. I think that has improved the satisfaction for our associates, for our nurses and others trying to reach physicians and other providers to get to the right person quickly. That to me has been the most dramatic difference.
Now that we have the ability to communicate back and forth with our nursing partners, we have been able to streamline that communication. So nursing knows that they can send a message out to the on-call physician or the physician that's caring for their patient and get a response back almost immediately from that doctor, rather than having to do a phone call or worry about who's covering for that person. Do they want to be woken up in the middle of the night? And those kind of things. That's all put into place now with PerfectServe. With the routing, gets it to the right person at the right time. They get their response back and patients get what they need.
The biggest impact we've had, I think, with nursing workflow has been our recent integration of PerfectServe into our EMR. We have directly integrated it into the patient chart, and so now providers and nurses and other care team members, the various respiratory therapists and others, can all utilize PerfectServe to communicate directly out of a patient chart. In Southeast Michigan, which is where our health system is, or our hospitals are, there are a number of other systems that utilize PerfectServe, so we have the ability to not just contact and communicate between the physicians who are on staff at our institutions, but there's also accessibility to a number of the big institutions and their provider staffs. We now have also several other Ascension Health facilities in Michigan that are utilizing PerfectServe, and so it allows us to communicate, with the providers between those institutions.
I think the accessibility to the schedule has been a dramatic improvement. With the mobile application, those kinds of things, making swaps, it makes it very easy for the physicians to do that. It makes it a lot easier to find out who's off or who's on to make those trades with. If there are any trades, people can simply put in a swap opportunity request, and it just goes out to those physicians that are off for the day. And that has it saved a lot of time having to search through the schedule and figure out who do I need to get a hold of today to make sure that I'm sending to the right person to request that time off.
After the physicians started using it in their practices, it made sense for them to also have the call schedule centralized in one spot. PerfectServe allowed us to store call schedules that impacted both the physician workflows in their practice as well as the hospital, so that if one change was made, it made the change universal for them. So they really saw the value in being able to manage everything in one location.
The ability to reach out and get communication to the right person quickly, obviously that facilitates the whole care team communicating, and that I think really has an impact on length of stay and folks being aware of what's going on with the patient, and so patients obviously they're happy with length of stay being less, and they're also happy if their care team knows what's going on and communicates well between the various members.
Imagine you're a patient in a room and you need something now for pain or what it's going to be. If a nurse has to make a phone call to a physician, you're going to get a message back. So your turnaround times on these things are going to be much improved. People are going to be happy if their pain's under control and things are happening quicker.
At PerfectServe, we recognize how critical it is to guide and involve patients and their families throughout the entire care journey. To support patients and to enhance providers' ability to maintain continuity of care, we've mapped out communication workflows that touch patients and their families before, during, and after every encounter. This approach is simple, personalized, and promotes meaningful communication between provider and patient. Healthcare communication cannot work in silos, and all stakeholders, clinicians, patients, and their families, should be actively involved in the care process. PerfectServe's goal is simple: deliver the right information to the right care team members, regardless of location, in order to achieve better outcomes for patients.